What if the thing we call burnout isn't weakness, but traumatic stress in the nervous system? And what if trauma isn't a life sentence? What if it's something that can be healed? Today, we're going into the hidden cost of for-profit healthcare on nurses, doctors, and patients, and the practical steps to stop pretending you're okay when you're not. Because trauma-free nurses don't just feel better, they bring healing into every patient interaction. Welcome to the Masters of Wellness podcast, where we explore the latest insights, personal journeys, and business innovations shaping the future of health and well-being. I'm Edward Curtin, 30 plus years in global wellness, bridging Eastern wisdom and Western science, and helping leaders build results that actually last. Today's episode is about traumatic stress and recovery through the lens of the nervous system and why healing matters, not just for individuals, but for the quality of care inside our healthcare systems. Joining me is Kathy Allan. Kathy is a board-certified holistic nurse, a retired energy healing instructor with the Healing Touch program, and a somatic experiencing practitioner trained to work with traumatized populations. She's also the founder of Gutsy Nurses, a program helping nurses give good care inside a dysfunctional healthcare system. Kathy's new book is Gutsy Nurses Save Lives. Kathy, welcome to the show.
Thank you for having me.
Absolutely. And I just wanted to share a quick story. We had a few little tech issues when we were setting up today. But as soon as I saw Kathy pop up on the screen, I felt a sense of calm wash over me. And I think that's something that really comes from experienced and caring nurses. And Kathy, as you've had a lot of experience nursing, is that something that you believe is true?
I do. Actually, I really do. And in the process of caring for other people, whether you're a nurse or not, it changes you and it deepens you and it gives you a greater capacity to hold the space not only for yourself, but also for the people that you're holding space for.
And you shared an interesting story as well, right? You went to a conference and you were looking for some nurses. Tell us about that.
Well, what happened, I was invited to speak at a conference that was being held at the MGM Grand in Las Vegas. And so I drove there and I was a little bit late and I didn't know where the conference room was. So I just walked into the area where they do all the gambling and I thought, okay, I'm going to look for the nurses. They'll tell me where it is. And I spotted them immediately. They have this different kind of an energy. You can tell when there's a group of nurses, you can tell that they have that kind of giving energy. So they let me know where the conference was and everything went out well. Everything went
Yeah,
fine.
absolutely. I remember a few years ago, probably maybe 5, 6 years ago, I just went in for a minor surgery here in China. And the nurses in the hospital where I was, they couldn't quite speak English, but they had a great way of communication. And this was the evening before I was in the hospital room waiting, and a nurse came in and she had a little notepad and she drew some pictures on the notepad. The first picture was a clock, which was 8 a.m. for tomorrow morning. And then the second picture was a knife with some blood on it, which represented surgery. And then the third picture was a plate of food with a X on it, not allowed to eat tonight. So basically she's saying, you've got surgery tomorrow morning, don't eat tonight.
Right, right. Well, it's a good thing to tell people, that they're going to be having surgery and at what time, but you want to take them to the next step about what's going to happen after surgery so that they have in their mind that they're going to make it through the surgery. So I'm glad you made
Mm.
it just fine.
Yeah, absolutely. It's just a small thing. Now, Kathy, when you say traumatic stress as a nervous system imbalance, like what are we really talking about in everyday language?
Well, what we're talking about is how stress affects your nervous system. And you mentioned before about my work with burnout. And there are actually two different kinds of burnout. There's a kind of burnout where you're just working too hard for too long and you're exhausted and you have to keep doing that every day. But then there's traumatic burnout. Traumatic burnout is when you have all the conditions of burnout. You're working too hard, like nurses are working way too hard for too many patients, not enough time to take care of them, can't even go to the bathroom in some cases or take a break. They know that one of their patients could be harmed or even die if they don't get to them in time. Now, that knowledge isn't just intellectual, that knowledge is in their bodies. It's in their nervous system, which activates. Now, you need to have your nervous system activated so that you can respond to danger. And that's what nurses are doing, is they're responding to danger, trying to keep their patients well. But if they can do that, then that just helps the body to discharge that energy that the body created to respond to danger. But if they don't have a chance to discharge that energy, then that's very bad for the nurse, because it can affect their immune system, and it also can affect their relationships to themselves and relationships to other people.
And just for the people that are tuning in at the beginning of our episode, who do you think can benefit from watching our episode today? Are you talking about medical professionals or people in
Well,
general
I
to
think
understand what
medical
happens?
I think medical professionals, of course, but also people in general, because I think it will help them to know what's going on in the hospital. And I will say that, when you feel like you're in a stressful situation, like if you're in an airplane and there's turbulence, the first thing people do is look at the face of the flight attendant. Little children, if they fall down, they look at the face of the parent or the caregiver. Am I okay? Is this going to be all right? Now, if that person's the caregiver or the flight attendant, if their face is calm and relaxed, then the patient knows, oh, okay, I'm safe. It's okay. But with nurses and doctors in the hospital, when they're really stressed, sometimes it shows on their face. And sometimes the patient will automatically think, oh, it's because of me. There's something going on that's very bad with me. When actually it's not. It's just the workload that that professional has that's affecting their body.
Mm. And
Does
for
that make
people that,
sense?
yeah, absolutely. And for
Okay.
people that have not experienced a stay in a hospital, we see it in the movies, the ER shows and things like that. Like what happens on a typical Tuesday in a hospital that creates this environment in the US healthcare system for nurses and
Well,
doctors?
yeah, the US healthcare system has really gone down. It's really controlled by corporations and not by doctors and nurses. And so what they're doing is their most important thing that they feel that they have to do is to make money. And some of these people are buying up private equity is buying up hospitals, nursing homes, and emergency services, because that's where the money is. So, but what they do in order to make profit right away, because their interest is to make profit for their investors. So what they do is they cut staff, and immediately then they'll have more profit. But if you cut the staff, then you don't have the people to take care of the sick people. And New York University, I think along with Stanford, I think it was, and I may be wrong on that, but I know it was New York University and another university that did a study. And they found that when private equity firms purchase a hospital, a nursing home, or emergency services, there are four major things that happen. There's an increase in falls for the patient, an increase in blood-borne infections, an increase in wound infections, and then an increase in adverse events following a medical or a surgical procedure. And that's because they don't have qualified nurses to watch over those people to make sure that they're safe.
Wow. And
Wow.
yeah, and for the nurses and doctors in this environment, like you did mention earlier, we talked about PTSD. Like, how does that progression happen? So obviously, a nurse doesn't just suddenly face traumatic stress in their life. It's something that happens over time. Like, what are the first signals of that, and what does that progression look like?
Well, I think that it may be different for different people. I think a lot of people are in denial and they're too numbed out to feel their body, to know what's going on. They're overwhelmed and they're numbed out. And so when that happens, you don't really feel what's going on in your body and you think, oh, I'm fine. I had a situation years ago. I was working in the intensive care unit. I was the only nurse for 6 patients. I did have a nurse's aide to help me, but these were six critical people with lots of procedures and IVs and lots of things that I had to do. But I got it done. I was working the midnight shift. I got everything done. And then when the day shift came on, I had to give them a report. And when I was sitting there giving a report, the tears started coming down my cheeks. And I was so embarrassed because the unit looked great. The patients were fine. I didn't lose anybody. Everything was fine. But I couldn't tell myself, you did a really good job. And I couldn't do that because I felt like I was a failure for crying. And part of that is because I was numbed out. I was just totally numbed out after that shift. And I think that happens to a lot of different nurses, that they get numbed out and they don't realize what's going on in their nervous system. So that's one example.
Yeah. In your book, you talk about how to stop pretending that you're okay when you are not. So that's an example that you just gave there.
Yeah.
You
Yeah.
put on the brave face and you gave the report in the morning, but it actually caught up with you
Yeah.
and the emotion
Right.
came out. Like
Right.
what are some of the ramifications of people that keep pretending it's okay when it's not?
Well, what's happened in healthcare, at least in the United States today, is there are a lot of nurses and also doctors and other healthcare professionals who feel a deep sense of betrayal, that they've been betrayed by administration who doesn't support them, who is also under a lot of pressure to make a big profit. And so people respond differently to betrayal. Some people go into maybe denial, or they'll disassociate, or they'll minimize, oh, it wasn't so bad, I'm really okay. Then other people will blame themselves, and the healthcare industry in the United States is very good at helping at blaming the nurses and saying, well, you know what, you just need to be more resilient. That's the problem. Your problem is that you need to be more resilient and you're not resilient enough. They don't take ownership of the way that they're scheduling the care. So another way that people respond to overwhelm and betrayal is to become more irritable, fighting, nasty. There's an increase in violence. And what we're seeing in hospitals in the United States is an increase in violence and bullying. And that is a result of the individual being overwhelmed and not knowing what to do with the energy of that overwhelm and then discharging it in an inappropriate way. That we're seeing that in the United States. And then there's another way that people respond to overwhelm. I forget what it is right now. Oh, I'll think about it and I'll tell you what it is. All of those are all defenses that keep people from really realizing that they've been betrayed. That's very hurtful to know that the administration doesn't care that much about you and it's putting you in a situation that's very traumatic. And that kind of an awareness is very hurtful. So when you become aware of that kind of thing, is when you can start your healing process.
You're opening up some incredible cans of worms here that even I had not realized. I have been exposed to some practices in the medical industry. I'm from Australia. I was a primary school PE teacher, and then later I got into the fitness industry as a personal trainer, and then later I got into management and more recently helping investors to design and build wellness centers. But during the early part of my career, when I was building up my personal training clientele, I went to a local medical clinic that was near my home. And on the outside of the door, they had the names of all of the doctors. There's maybe 8 or 10 doctors' names on the door. So I wrote down all those names. I went home and I wrote some personal letters to each doctor, introducing myself. This is who I am. This is what I do. If you have any patients that can benefit from exercise or losing weight or something, please refer them to me, and so on. So it was quite successful. And actually, the manager of that medical center, this lady, she got one of those letters and she was very, very impressed. So she actually became one of my clients. So now I was training the manager of the medical center. And then she was telling all the doctors, you need to send your patients to this guy. He's really, really good. But she was explaining to me a lot of the things that were happening just in a medical clinic, like treating it as a business. She was a manager. She had KPIs. She had revenue targets. And she said that some of the doctors would even, prescribe certain tests or treatments for patients just to add on to the bulk billing for the Medicare and things like that. And one particular case, a 12-year-old girl was recommended to go and do a pregnancy test. And the mother inquired about this. And the girl, she was 12 years old. She said, I've never even had sex before. I've never even had a boyfriend. Like, why am I having a pregnancy test? But it was one of those things they could add on to the bill at the end. So that was quite shocking as well. But just going back to your experience in hospitals, obviously you've had an incredible career in the medical profession, and now you're speaking out, or let's say now you're bringing awareness to this so other people that are in the industry now can identify some of the red flags that are popping up. But did this happen to you? Like, was this something that you experienced first? You went through this journey and now you're in a position to be able to help others?
So I'm going to answer that in just a minute. But first, I want to comment on your experience of knowing that people were being charged with extra tests that they didn't really need. So, what are they going to need? How are we going to treat them? Well, the first thing they do is order more tests. You've got to have lab work, you've got to have diagnostic tests, and that brings in money for the facility. And so, not every facility does that, but that is a practice that's going on. So, as far as my experience goes, I'm older, you may have guessed with my white hair. And when I became a nurse, it wasn't for profit. It was a nonprofit, and the healthcare industry was more like a caregiving service. Then in the 70s, we got the Managed Care Act. And from then on, and especially in the 80s and 90s, it really went into a for profit business. And there's a philosopher, a social, and well, he's more of a social philosopher. Eric Hoffer is his name, and he made a comment one time. He's reported to have said this. I don't know if he actually said it, but he's reported to have said that every good idea starts out as a movement, turns into a business, and then devolves into a racket. And I really do think that in the United States, at least, we're in the racket phase. And one thing about that is that nurses and doctors and other healthcare professionals, as well as the general public, are waking up to that. And once you wake up to that, then you can change the system. But until you're awake, the system doesn't get changed. And I will say that not everybody who's in the system, not everybody who's an administrator or works for a different company, not all of those people are happy with the situation as it is, but they're caught in a system that is pretty negative. So I know I'm going on and on here, but
No,
as far
no,
as
that
my own personal experience was that, so I worked in the hospitals when it wasn't for profit, when our main thing was to give care and to help patients. And it was really a wonderful time. And so when the system changed, I really could see it. Now, there are a lot of people who are working in the system today who have had no experience working when it was a caregiving service. So I was aware when the changes started happening. And in the unit where I was working, we started getting too many patients, not enough people to take care of them. We would complain, and they fired everybody, and then they hired everybody back. And then they said, well, we're doing this because we're improving the health care. And we said, no, you're downsizing. They says, no, we're not downsizing, we're right sizing. And what happened when they made the changeover is that the care used to be an action word when I first got into healthcare. Today, it's a marketing term, which is really sad. But I think now that there's so much going on, people are willing to step forward to help change the system. And that's when I got the idea that, I need to, I studied so much about trauma. I need to help nurses know that there's two kinds of burnout and that many of them are experienced traumatic burnout. And so I developed a program to teach them what's going on in their nervous system and how they can change that. And then my book, I've changed the title. It's Gutsy Nurses, How to End Burnout and Take Back Your Power. Because once nurses and doctors have their power back, that means good care for patients. So it's not just, a selfish kind of thing. It's a way to give good care to your patients.
my experience of people that I know that work in the medical profession, particularly nurses, is that it's a type of person that has a really caring character. Like from when they're children, they have empathy, they they love animals, like they've always had this type of character about them. And so they naturally gravitate into this profession because it's where they can express that passion. Unfortunately, those type of people tend to, I want to say this in a way that doesn't sound wrong, but is it true that that type of caring person can be taken advantage of more so than?
Absolutely. And in my book, there's a whole area devoted to exploitation. What sets you up to be exploited? Part of what sets you up is the betrayal that's going on and your need to not see it. Oh, no, tell me it's not really happening. It's too painful. Then another thing that helps nurses be exploited is maybe some of their childhood wounds that can get in the way and then can help them to not see the exploitation that's going on. And so it's easier for that nurse to burn out. And I don't know if this would be a good place to say it, but nurses are, and doctors too, are treated so badly that nurses have an 18% more chance that they're going to commit suicide than the general population. And
My
that's,
goodness.
I know it. And that's because of the working 12 hours a day, and many times more than that. They were told you're going to work 12 hours a day for 3 days and then you're going to have 4 days off. That hasn't happened. That's People are working more than just 3 days for their 12 hours and working more than 12 hours, having too many patients, being isolated from their family, afraid they're going to make a mistake. Let's see, and feeling like they're not supported by administration. There's a lack of balanced life where you've got time with your children and your family, and you've got your work life. And so, anyway, all of those kinds of things affect nurses, and so I think that's why they have a higher suicide rate.
When we see nurses going on strike, the media portrays it as they want more money, but it's not about
Yeah.
that at all, is it?
Well, actually, that's what the media uses to turn people against them. What nurses are going on strike for is for more help. Give us more nurses so that we can take care of our patients. Now, I'll tell you, I have a friend who was working at a large hospital, and she had 6 patients to take care of them. All of them were more acute. One of them started having problems, and so this nurse needed help. So she found the nursing assistant on the unit to see if the assistant could help her. The nursing assistant, had 16 patients to take care of. And so, of course, that nurse didn't get any help. So she made it through, took care of the patient, and then she complained to her supervisor. She said, I need more help. This isn't working. So she was fired for complaining, that she's a complainer. So they fired her. And then what she did now is that she's working with another nurse to get the state legislature to mandate safe staffing levels. So that's a sad story, but it's true. It's happening. It's not happening in every hospital, but it is happening. And that's why I'm writing this book.
Yeah, that's incredible. And given your years of experience, like you said, 70s, 1980s, 1990s, like you've seen some incredible changes, obviously through the medical profession, improvements in technology and practices, as well as some of the conditions that we're talking about today. Like, and in addition to being a registered nurse and doing all of that study, you've also branched off into somatic healing and other things as well. Like, tell us about that. What inspired you to explore, and how has that helped you with?
Well, I was working and I looked out the window at the hospital where I was working, and I saw the cleaning lady dressed in scrubs discharging a new mother with her baby, helping them get into the car. I was horrified because that's the job of a nurse. Because if anything goes wrong during that discharge, the nurse will be there to make sure everybody's safe. So I went to lunch that day, and everybody that I saw on the hallway on the way to the cafeteria was in scrubs. So I asked them all, I said, what department do you work in? None of them were nurses. And then a very important looking woman came and confronted me. And she told me if I didn't stop asking people what department they worked in, that she would call security and have me removed from the hospital. And that was so traumatizing to me. It might not have been traumatizing to somebody else, but I have a trauma history that I didn't know about at the time. And that was so traumatizing to me that I thought, I can't work here. I cannot work in a hospital that's fooling their patients into thinking they're being cared for a nurse when many of them are not. So I quit my job and I thought, okay, how can I deal with this? So I thought, okay, I need to learn everything I can about trauma and heal myself and then see what I can do as far as after I learn everything. So I graduated from 4 different trauma training programs. And in the process, I've been able to heal myself. And so, okay, the next step then is to share what I've learned and to help others. So that's how I got into this, working with trauma. And what I learned is that years ago, they thought trauma was a life sentence, that you were going to suffer from it for the rest of your life. And there's so many new approaches to work with post-traumatic stress and overwhelming trauma that release the nervous system from carrying that trauma in the nervous system, and the person can be healed. So that's really great news.
Yeah, often from trauma comes pathways to new ways of healing as well. And just
Exactly.
just focusing on that, the trauma aspect there, people working in the medical industry now, medical profession, or even other professionals for that matter, tuning into our podcast today, what are some of the patterns that they may see that could be some indicators of there's some trauma brewing here, what
Right.
to look out for?
Yeah. Well, I think, looking out for the fact like your life may be more constricted, where you don't feel like going out anymore, and you don't feel like being with people, and you're much better if you're at home. So what that tells you is that too much stimulation is too much for you. And so there's that to look out for, sleep problems, eating problems, either overeating or undereating, being irritable and reactive, highly reactive, where you have a temper that just goes off just like that, can be an indicator that you've got some trauma in your system and it's trying to release itself. But there's ways of learning how to release that trauma without damaging your own self-esteem and without hurting other people. So those are
It's
some
in,
of the
yeah, it's
symptoms.
interesting. You mentioned self-esteem there. Is it true that people may be facing some trauma or difficult conditions in their work environment and they start to blame themselves, or they start to lose sense of the reasons this is happening is maybe because of me? If people keep telling me you're not working hard enough or deal with it or stop complaining, do they start to internalize and
Yes, they do. And what you're talking about, what it sounds like is shame, that people
mm,
will start to, they are sometimes shamed by other people and then they shame themselves. And then that keeps them in that trap of not being able to move forward, but carrying the trauma. And one of the things that I have in my program that I've developed is coaching. And that's for people who would like to move forward, who are ready to move forward, but it's hard to do it all by yourself. And so we have a coaching problem that can support people as they're moving forward in their life. I will say another really good thing that's happening is that more and more nurses and other healthcare professionals are joining unions because there's safety in numbers. And also, they can share with each other what their experiences are and can support each other. So I really encourage that too.
can you tell us about your program? Like, how did it come about? What type
Well,
of people do you find are being attracted to it, and what results are you seeing?
Well, actually, I've just finished developing it. And when the book is released, the program will be released at the same time. But what the program is, there's 5 steps. And the first step is to understand what is happening in your body when you're overwhelmed or when you're burned out. And then the second step is how to interrupt that traumatic stress continuum. The second step on my program is really a lot of fun because I show this video that is so funny, but it clearly identifies each stage in the progression of too much stress, too much trauma. So then the third step is how to own your own gutsiness and how, what's involved in that? How do you do that? And the fourth step is what I call the 12 steps of healing care. Now, one morning I woke up, just to back up a little bit, I've worked with chemical dependency for years. Almost 20 years I worked in the chemical dependency unit, alcoholism treatment unit. At any rate, I woke up one morning and I felt like something's coming through. I've never had that experience before. So I grabbed a pen and a pencil, a pen and a paper, and I wrote down everything that came through, and it was the 12 steps of healing care. Now, it's not an adaptation of the 12 steps of AA, but it was inspired by the 12 steps of AA. And it's especially helpful for people who are still working in the hospital, who love working in the hospital and don't want to quit. And it shows them how to bring in the healing power of the universe to help them give good care. So that's the first step. And then the last step is called looking in, speaking out, which is kind of like, where do we go from here? And so it's very concrete suggestions on what people can do to bring good care into the world. And also, what's happening is nurses and doctors are being erased in the American healthcare system. Suggestions that I have are to help nurses to not erase themselves and to bring their goodness out into the world, so people can have reaffirmed of the goodness that exists, that wants to help them. So that's the program. And then people who complete the program can go through the coaching program. And then what I'm looking forward to is having an annual celebration for all the nurses who've taken some kind of step, whatever it is, some kind of step to improve healthcare. So that's a big party. That'll be a lot of fun. We have to have some fun here too.
Yeah, absolutely. And just on that particular note, we are an international show. I'm in Asia, China. I'm from Australia. We have listeners in Croatia. We have listeners in Middle East. We have many listeners in North America as well. So outside of the US healthcare industry, what are some of these key talking points we've mentioned today that
Yeah.
are
Well,
universal?
yeah. Well, a lot of us think that we need to have Medicare for all, where the government pays, because the government doesn't want you to be sick. They want things to happen so that you stay well. Whereas when the industry takes over, corporations take over, they want you to stay sick. Now, I know there are a lot of companies who are having universal health care, and they're having their challenges, but they're on the right track. And so they can fix the challenges that they're experiencing and keep going forward. But they're making healthcare a right and something that everyone deserves to have, which is different from what we're seeing in the United States. So I'm looking forward to what they're doing. I know that there's a lot of people who are doing a lot of really good work in other countries. And so I hope that the United States will learn from them and develop a program in the United States that will be helpful for everyone.
You did mention your work with the chemical dependency, and the healthcare business or the healthcare industry
Yeah,
is largely a responsive business, right? Responding to people who have become sick.
yeah, yeah.
Let's go back before that. What is some preventive health things that you wish some of your patients had taken earlier in their life that would mean they're not with you today in the hospital?
Well, of course, the usual things, diet and exercise and social contact. It's really important to have good relationships with people in your community, to be involved with your community. But I'm reading a book right now by Gabor Mate, called The Myth of Normal. And in that book, he talks about the people who are having heart trouble, that there's a personality that goes along with that. There's a lot of anger that's not able to be expressed, so that affects their heart. And so they know about that, and they have programs to help people with that. But I was really surprised to learn that there is a type C personality. The anger one is a type A personality for heart attack. But there's a type C personality, which is the kind of person that is susceptible to getting cancer. And I didn't know they had such of that. And that person is like so nice, just so very nice, and never angry, never complain, always think about the other person to an unhealthy amount. And so another thing to help people stay well is to help them be authentic and not be afraid to be authentic. And if they've had wounding in their childhood that has shut them down, to kind of understand that and hold space for them as they, try to work their way out of that. So that's another thing that people can do. And I will say that the nurses now, there's a huge movement in nursing to become coaches. And that's wonderful because if you can keep people healthy, you can keep them out of the hospital. You can keep them out of the system, which is the goal that we all have for people.
Yeah, we had a guest on our show late last year who is a cardiac surgeon, and he spoke about he gets a lot of patients coming to him at the point where they need surgery. Like they've had a cardiac event and they're in for surgery, and they often express regret, saying, I wish I had.
Yeah, yeah, yeah.
And he had a really great approach to that. He said, you may have missed the first chance, but now you've got the second chance after the
Yes,
surgery, rather than saying,
yes.
I wish I had 15 years ago. Now you've got the opportunity, the second chance to take the action now. And that type of conversation with the patients is often quite effective. There are outliers where some people go back to the same habits again. He sees them 18 months later for another round of surgery, which is kind of weird. But you spoke at the beginning of the show about what happens after surgery. So we've got nurses that help you prepare mentally, emotionally, physically for going into some traumatic event or some surgery, and then coming out of that and then on their way home. Like, what is the role of nurses there, and do they have time to be able to take that extra care with patients?
Well, I think what it is in today's world, they don't really have a lot of time. But what you want to do as part of your preparation for surgery is to help people be thinking about what they need to do after surgery, which subconsciously helps them to know, oh, I made it through. Years and years ago, we used to tell people, okay, now after surgery, I'm going to be with you and I'm going to have you cough and deep breathe and I'm going to have you move. And so they knew that they were going to have somebody there with them, but that they made it through and that they had work to do after they made it through. Now, today, they don't really have to do that so much because they have, ways of controlling the anesthesias much better. And then they've got these pumps that they can put on their legs to keep the circulation going. So they've got a lot of things that they can do. So I think, when you have a nurse or a doctor or any healthcare professional that's really connected to you, that you can sense that compassionate connection, that gives you hope, that gives you, it affects your soul and it affects your ability to go forward with your life.
Does that energy go both ways?
Absolutely. Absolutely. It goes both ways. It affects the nurse just as much as it affects the patient. Because when you have that compassion, it it affects the soul of the nurse, it affects the soul of the patient, and that's what life is all about, isn't it? To affect our souls and make our souls grow and be happy and feel safe.
Absolutely. I discovered last night that the word universe, uni means one, and verse actually means frequency. So universe means
Yes,
one frequency.
yes.
And you mentioned that word earlier on in the show as well. That's when people's frequencies are aligned. And I think that's something that nurses have the ability to do, is meet the patient where they are at that moment and match the frequency, and then bring them up to,
Bring them up,
to,
right.
to where they would like them to be.
And how that happens is when the nurse, or it could be a family member, or it could be the doctor, it could be anybody who has a high frequency, who's really in a good place themselves, when they walk into the room, they bring there's an energy field around everyone. And the patient's energy field can sense the frequency of the person who's coming in to see them. They can sense that frequency, and that helps them to rise up their own energy field to a higher frequency. So it's not something that you do as a task. It's something that happens when you keep your frequency high. And you'll hear stories about a patient that just felt better the minute the doctor walked in. And that's because the doctor is bringing his energy field with him.
Yeah. And you also mentioned that there's been times in your career where you've had 6 patients, 12
Yeah.
patients
Yeah.
or more. How does that affect the nurse when you've got a bunch of sick people who may not be
Well,
at a high
yeah, it is.
frequency?
Sure. And that's when I mentioned before, when the patient will look at that nurse who is so burned out, and they'll see the expression on her face, or his or her face, of stress. And then it does affect the patient, because the patient automatically thinks it's about me. I'm not doing so good. They don't think, oh, that nurse has got too many people to take care of, or that nurse is too tired. No, so it's not good for the patient, for the nurse to be that burned out, that overwhelmed, that stressed.
Yeah, that's true.
Yeah.
Um, some of the nurses that are watching our show may be thinking, this is great information, but there's a long road to get there. What is a 60-second tool that can help people that are stuck in this moment right now and they just need to get through today?
Well, there are some things that people can do that don't take very long. One of them is very simple. Just cross your arms and put your hands in your armpits, and then focus on your breath. And don't make your breath go deeper or slower, but just notice what it's doing and allow it to go deeper and slower when it's ready. So that's a quick thing that people can do. So, and that'll take a couple of minutes. Sometimes it's longer for some people and shorter for others. All depends upon their state when they start doing it. Another handy thing that people can do is something called push hands, when you are feeling this sense of anger or frustration within you. So you have somebody who is the pusher and somebody who is the pushy. And the whole idea is not to see how strong you are, but to bring forth that energy that's kind of stuck in your body, and just push. That's all. Just notice what happens in your body when you're pushing. Now, sometimes you don't always have somebody to push with. So just push against the wall. That's all. Just so that you're pushing and bringing your energy up. And that'll help people. And then there's one more thing that they can do, and that's to make the VOO sound. And that's take a very deep belly breath, very deep. And then when you take it through your mouth, and then when you let it out, make the sound. So I'll show you. So you just let it go all the way out. This one's very good for when you're feeling hopeless and a sense of despair. So that one's very helpful. And I'll just leave you with a statement, and that is, remember, denial is a shock absorber for the heart. So don't be hard on yourself if you haven't realized some of these things that we've been talking about. Your heart's protecting you.
Denial is the shock absorber for the heart.
Yes.
Wow, amazing. The title of your book, Gutsy Nurses and Be Gutsy. How did that title come up? Like that's a great word, but what's the thinking behind that?
Well, at first I thought I would call it Gutsy Nurses Save Lives, which is very nice. But then I thought, what are these nurses complaining about? What are they dealing with? They're dealing with burnout. And so I know how to deal with that. So how about let's call it Gutsy Nurses, How to End Burnout and Take Back Your Power. And take back the power that you have to provide good care, that the corporations and the industry isn't really interested in. They just want profits. So we're interested in care, not profits.
Kathy, this has been like a really insightful and inspiring episode, and there's a lot to unpack. Even when I go back and watch this over again, I can see there's so much information here. Just to kind of unpack what we've talked about today, what are the 3 big takeaways you would like listeners to walk away with today?
You deserve good. You deserve to be treated well. Almost everyone, not just you, but almost everyone in this world has experienced some kind of trauma. We all have, but it's not a life sentence and it can be healed. So that's the second one. Trauma can be healed. Then the last one is the courage to be authentic comes with healing your trauma. So the more you heal, then the more authentic you can become.
Mm, wonderful. For everyone listening, Kathy is at www.gutsynurses.com. Kathy, when people arrive to your website, what would you like them to do?
Well, there's a 5-minute video on the homepage, which will give them more of an understanding of trauma. And then I have under resources, I have some 2-minute videos that give them some tools that they can use to help themselves. But also, I forgot, on the homepage, they can download a PDF file that gives them simple tools to help them rebalance their nervous system and help them with trauma. And then, of course, my program, you can check that out.
Yeah, fantastic. We will put the links to your website in the description. We go across multiple channels. We're on YouTube if you want to watch the video or all of the audio podcasts. If you're listening, you'll see the links in the description. Number one, please subscribe. It helps to grow the channel and share our message with the world. Two, leave a review and comment, please. It certainly helps us to know what you're getting from the show. And three, share it with at least one nurse or caregiver or leader who needs a calmer nervous system and clearer boundaries. And if you want more, join the Masters of Wellness community. Links are in the show notes as well. Kathy, it's been a real pleasure to speak with you today and understanding what is happening behind the scenes when people facing their own health challenges, that there is a team, there's wonderful caring people that are doing their best to help you. Thank you so much.
Thank you. It's been a real pleasure for me to share what I know.